Good morning, students. So today we are going to see about National AIDS Control Program. Current scenario: HIV situation in the country is assessed and monitored through regular annual sentinel surveillance established since 1992. Because from that time onwards, HIV became a major health issue in our country. So we have started this surveillance to identify more and more of HIV cases and catch hold of them and start the treatment and save their lives. So that was the aim of this sentinel surveillance. So similarly, this type of surveillance was done since 1992. Estimated adult prevalence in our country 0.34%, and it is greater among males and than among females. So the prevalence is more among males compared to females. New HIV infection in India have decreased by 46%, and AIDS related death have increased by 22%. So both the new arrival of the cases with HIV and also the mortality because of HIV is also reduced. That is only because of the proper implementation of this program and making the public aware about this disease and how to prevent the disease. So these all aspects made the disease rate is highly reduced. India has been estimated 2.1 million people living with HIV. So this is the statistics of HIV cases in our country, that is 2.1 million people. A very high prevalence is seen among high risk groups. So these are the high risk use, that is intravenous drug users, male sex male, female sex male workers, persons with sexually transmitted diseases, and low prevalence among ANC clinic attendants. So this is how we all know that which are the different ways by which this HIV is being transmitted. So in all these cases, the risk of transmission and the prevalence is very much risk. You can see the percentage, a majority male sex with female sex with male. So intersexual is the main cause of this. Having more than one partner is a major cause of this HIV. And similar to that, you can see male sex with female and also intravenous drug users are also having a major percentage of prevalence, high risk for the prevalence of HIV. So first case is detected in Chennai in 1986. Virus is spreading rapidly across the nation, both in the urban and rural areas. 6 high prevalence states in our country is Andhra Pradesh, Maharashtra, Manipur, Nagaland, Karnataka and Tamil Nadu. And government, since due to a lot of issues are coming up with this health problem, government have started this National AIDS Control Program. National AIDS Control Program is having 4 phases, that is phase 1, phase 2, phase 3 and phase 4. In phase 1 started from 1992, duration is till 1999, and phase 2 from 1999 to 2000, and phase 3 from 2007 to 12, phase 4 12 to 17. So that is all by National AIDS Control Organization. So under the phase 1, the main objective is to slow the spread of HIV, to reduce the future morbidity, mortality and the impact of AIDS by initiating a major effort in prevention of HIV transmission. So how to prevent new case arrival? Phase 2, that is 1999 to 2006, reducing the spread of HIV infection in India and strengthen India's capacity to respond to HIV epidemic on long-term basis. So almost similar to that only in phase 2 also, mainly to reduce the spread of infection in our country and thereby also making the public aware about the disease, and as long-term basis making the public what measures has to be taken so that this disease can be prevented. So in that aspect, interventions are being implemented. In phase 3, it is based on the experience and lessons drawn from NACP 1 and 2, and it is built upon their strength. So the lacunae are being solved and with the interventions more strengthened, and that is how it is being implemented. In phase 4, the Cabinet Committee of Economic Affairs approved rupees 8,632.77 crore for the implementation of National AIDS Control Program by the Health Ministry, Department of AIDS Control. So this much of amount is being used for the proper implementation of the program. ART medicines are being provided free of cost in all the government hospitals. As public-private partnership, it is also being provided in the private hospitals with free of cost. So that's how the transmission rate is also reduced very well. Main objective of these programs are to reduce the new infections by 50% and provide comprehensive care and support to all persons living with HIV/AIDS and treatment services for all those who require it. So to reducing the case, and similarly adherence to the medications for the positive cases are very important as the main core theme of this or core objective of this program. Highlights of NACP 4 is the reversal of AIDS epidemic through a participative approach. So more and more patients with living with HIV is being identified, and they are bringing to a group called self-help group. So in that way, such kind of groups are being made, and they themselves will tell about their health issues, thereby how they can their group itself will give solutions from one or the other person. So in that way, participative approach, the AIDS disease are being prevalence and the complications due to AIDS and arising of the opportunistic infections can be controlled very well through this participative approach. Targeting high risk group, that is truck drivers, migrant population, pregnant women are the high risk group. So they are highly targeted, and they are given special health education and health awareness through various mass medias about the disease awareness and the mode of transmission and how it can be prevented. And high risk group are always monitored for HIV infection. Strengthening the response in India through a caution and well-defined integration process. So all these interventions are strengthened very well, and lacunae are solved, and this phase 4 is continuing till now. Wide range discussion with stakeholders, that is people living with HIV/AIDS, PLHA, civil society, NGOs, positive networks, technical experts, government representatives from state and central ministries. So all are working together for the proper implementation of this program. Promotion of condoms, upscaling the ART medicines, that is antiretroviral medicines are being provided, and this therapy is all these medicines are regular supply of medicines are being done in all the depots and in health centers, thereby it is easily available to the individuals affected, and these grassroots level workers are regularly monitoring that they are adhering to medications or not. More motivation is being given for the victims to get on with the medications and to prevent opportunistic infections in future. Social protection by reducing discrimination to AIDS patient and families. Budgetary allocation of NACP 4 for 5 years of 14,295 crore by GFATM. GFATM is Global Fund for AIDS, tuberculosis and malaria. So this is a global fund that is being provided under this GFATM, and this fund is being utilized for the various activities coming under this GFATM, mainly for AIDS and tuberculosis and for malaria. This fund is being utilized. Parent to child transmission is being prevented, that is mainly by pregnant ladies are regularly monitored for HIV, and mother to child transmission is being prevented by proper medications. There are a lot of medications which seems to be very successful for the pregnant ladies to prevent transmission from mother to child, and immediately the child to be prevented from HIV. So all these things are being done.